Thank you very much, Dr. Walensky. I'd like to spend the next couple of minutes in addressing a much underutilized intervention for COVID-19, and that is the use of monoclonal antibodies for the treatment and prevention of SARS-CoV-2 infection and COVID-19 disease. Next slide. For those not totally familiar with this, monoclonal antibody is an antibody that's produced by a single clone of B cells or a cell line and consists of identical antibody molecules that can actually be produced in the in vitro situation in unlimited quantities. Next slide. If you look at the virion on the upper left part of the slide, and you look up the blown up spike protein, the red molecule on the right upper panel, when you talk about polyclonal antibodies, which result from infection or vaccination, it's a group of antibodies against every aspect of the spike protein, which is the good news. However, the concentration and the affinity of those antibodies can be markedly improved if you get a single cloned antibody, hence the word monoclonal, that's against a very specific part of the spike protein that can have a major effect in prevention and treatment. Next slide. So let's look at what we have. We have 3 anti-SARS-CoV-2 monoclonal antibody products that have currently had emergency use authorization from the FDA. And the EUAs here are for adults and children 12 years of age and older who weigh at least 88 pounds. There are 3 of them. There's the Lilly product, the bamlanivimab plus etesevimab. There's the Regeneron product referred to as RegenCov. And then there's the GSK and Vir product. Each of these products targets the spike protein of SARS-CoV-2. Next slide. So you can do an indication for these antibodies that are twofold. The first is to treat infection with SARS-CoV-2. Next slide. And in this regard, clinical trials have demonstrated that early treatment with anti-SARS-CoV-2 monoclonal antibodies can reduce the risk of COVID-19 hospitalization or death by 70 to 85%. It is important to emphasize that this must be done early in infection and not wait, of course, until a person is sick enough to be hospitalized. That's when you get the best effect. And again, being an underutilized intervention, we want people out there, including physicians as well as potential patients, to realize the advantage of this very effective way of treating early infection. Next slide. Now, if you look at the people who should benefit from this, this is a list from the FDA and the NIH treatment guidelines about all of the people who may have significant benefit from this type of therapy if given early in their infection. I'm not going to go through each and every one of them, but as you can see, there are a number of conditions on this slide that could benefit from the monoclonal antibody treatment after infection. Next slide. But there's also the benefit of prevention using monoclonal antibodies. Next slide. And we know now that the FDA, just a couple of weeks ago, authorized the Regeneron monoclonal antibody for post-exposure prophylaxis, namely for the prevention of COVID-19 after someone has been exposed to a documented case of SARS-CoV-2. And even now, and I won't show the data because of lack of time, there are now studies in pre-exposure prophylaxis as well as other studies in treatment. So I'll have on the last slide, next slide, the treatment guidelines panel. We can give you all the information and it's accessible on the website shown here. And for physicians, patients, and others who want to know how you can get monoclonal antibodies administered, this is the call center, and this is the online way to approach it. So, bottom line is, this is a very effective intervention for COVID-19. It is underutilized, and we recommend strongly that we utilize this to its fullest. Back now to Vivek Murthy. Dr. Murthy.
Well, thanks, Dr. Fauci, and it's really good to be with all of you again virtually today. Yesterday's FDA approval of the Pfizer COVID-19 vaccine is a new milestone for our country's vaccination efforts. We know that some people have been waiting for this next step to be complete before they choose to get vaccinated. And if that's you, the time to get vaccinated is now. I want to talk about what approval will mean for three major groups that have played a key role in getting people vaccinated to date. First, the approval will help doctors and nurses instill even more confidence in the vaccine among their patients. More and more, clinicians are talking to their patients about vaccination, recognizing that they are among the most powerful voices in helping people understand the life-saving benefits of the vaccines. They're also administering the vaccines in their clinics and hospitals. According to one estimate, the number of primary care practices which administer vaccinations in their offices jumped from less than 40% in April to over 75% in mid-July, which means that it's a lot easier now for patients to get vaccinated during routine visits. In addition, 4 of the country's largest health systems, representing 315 hospitals and more than 30 million annual patient encounters, have just committed to making vaccination more convenient by vaccinating in primary care offices, hospital discharge points, and emergency departments. And an additional 29 healthcare networks have committed to proactively reach out to their unvaccinated patients to make vaccines available at more primary care offices and to arrange transportation to vaccination sites. Second, the approval will also support employers and educators in their efforts to vaccinate their workers and students. As our kids and young people return to the classroom, we know that many schools and universities and businesses have established vaccination requirements in order to create safer places for people to work and to learn. Yesterday's approval by the FDA will help nudge organizations who may have been on the fence about vaccine requirements to move forward with such plans. It will give these institutions one more reason for their students and employees to get vaccinated. They'll be able to tell them that the FDA approval represents the gold standard for vaccine safety and effectiveness. And they'll be able to tell them the FDA didn't cut any corners to approve the COVID-19 vaccine. What they did do is work around the clock, reviewing hundreds of thousands of pages of data and inspecting the facilities where the vaccines are produced. After all that, the Pfizer vaccine passed the FDA's rigorous review, yet another reason to feel confident that getting vaccinated is the right thing to do. And third, the approval will embolden and equip our COVID-19 community corps with even more tools to talk to their communities about vaccination. Since the spring, we've been building this people-powered movement of individuals and organizations across the nation based on our belief that health information is best when it comes from local trusted sources. The thousands of conversations that our community corps members have had in recent months has led more people to get vaccinated, and those conversations have saved lives. Now they have yet another tool to help people understand the safety and effectiveness of the vaccines. You know, at the end of the day, the reason we are making progress in increasing vaccination rates is because in the face of the Delta variant, everyday Americans are doing their part to talk with each other about getting vaccinated. We're making progress because so many doctors and nurses and other health professionals are taking time to have these conversations with their patients, even while they work around the clock to care for the thousands of people hospitalized with COVID-19. So if you are not vaccinated, the FDA announcement gives you one more reason to get vaccinated. Please do it. Please get vaccinated. Do it for your own health. Do it for our children who are unable to get vaccinated and rely on the rest of us to shield them from infection. Do it for our healthcare workers who are running on fumes as they struggle to care for COVID-19 patients in overflowing hospitals for the 4th time during this pandemic. And do it for your community, which needs more people like you to get vaccinated in order to return to normal. If you are already vaccinated, this is the time for you to talk to your family and your friends and urge them to get vaccinated. The Delta variant continues to spread, and everything we have learned until now has told us that the vaccines are the best way to save lives and keep people out of the hospital. Thanks for your time. I'll pass it back to Jeff.
Thank you, doctors. Let's open it up for a few questions.